Medicine, very, very important. So a neurosurgeon, the way you do a neurosurgery, and I'm no neurosurgeon, but I just talk to them and see them, is they do a scan of your brain to see where the tumor is growing. And they basically get, it's not exactly a 3D view, but it's cut into slices, so they kind of put it together for 3D. And the problem with a neurosurgeon is when they go in to cut out the tumor, tumors don't grow like perfectly flat or perfectly circular. They have roots, and you got to get all the little roots out as well as, you know, the tumor itself. If you cut too much, you can paralyze the individual, you know, speech or whatever. If you cut too little, it can grow back. That's the challenge for a neurosurgeon. So then VR came into the picture, virtual reality, that headset. So here's what they do. They do the same scan at the hospital, at the medical centers. But they also have a brain that was built with computer-aided design. So it's an actual brain, and they then overlay the 3D scan on top of the brain. And during the operation, the surgeon is seeing, and they color code the scan. So it's, you know, green and red and purple and blue. And they overlay that on the brain. And while the surgeon is doing the scan, he's looking for where the green is hooking under, and green is the bad guys, and he's taking that out and make sure he gets that one. And he's leaving the red because that's that's tissue and it's not going to affect anything. Well, today in neurosurgery, 24% of the time, neurosurgeons change their way they're going to do the operation as a result of virtual reality. So that's pretty impressive, and that drives this home of how significant virtual reality is to a surgeon. There isn't a young surgeon, neurosurgeon in particular, that would even consider doing an operation today that hasn't been through a virtual reality understanding and utilization of this tool. I'll give you another example. I put it in training, and that's a big one because lots of companies, particularly the pharmaceutical companies, are training or onboarding people through augmented reality in this case. Sometimes they use virtual. Doesn't make a difference. And what happens, they have a new job in a lab with new equipment. So what do? You could spend 2-3 months to teach somebody how to learn all the equipment and, you know, to feel comfortable, or you can spend about 2 weeks at home in virtual reality or augmented in some cases to learn the exact same lab, to turn on the equipment, to watch it, you know, do its thing, to carry, you know, product from A to B inside the lab, so that when you walk in 2 weeks later, you're completely comfortable. It's like you were there yesterday. So what that does is it cuts the amount of training time down by about 70%, and it cuts the cost by about 60%. That's pretty significant if you are hiring Gen Zers